Health is a fundamental right of human life. With poor health, one cannot truly enjoy the basic necessities of life. Because of this, countries have researched and found ways to make the well-being of health easily accessible to its people, hence universal healthcare. The system is currently a staple in many developed countries, making everyone from the poor to the rich have access to basic medical needs. Africa currently has 11 countries implementing universal healthcare, with majority of West and Central Africa neglecting this system. So what would an Africa with universal healthcare look like? That is what we'll discuss today on GreenClick. By the way, be a friend and subscribe, click the notification button to get alerts, and like the video to help us make more videos you love about our amazing continent. Let's dive in. For us to imagine free healthcare in Africa, we have to look to other countries and see how the system works for them. Free healthcare means that we would pay very little to nothing for the medical attention and the drugs we purchase from the pharmacy. The first country we look at is Canada. In Canada, anybody can visit the doctor's office for free. You could also have surgery for free as long as it's not cosmetic. How this is done is through taxation and public funding monitored by each province. In previous years, Canada has also used 10% of its GDP on healthcare, with some privatized insurance companies helping out. However, in Canada, when it comes to purchasing drugs, you may have to co-pay, deal with a cost ceiling, or be part of a subsidy group. In other words, you would usually pay for over-the-counter drugs or pay a reduced fee for prescribed drugs. Using the ambulance, dental and eye care are specifically not free. However, they could be free if you enroll in health insurance through your workplace. Overall, this system puts health first before money, as anyone needing any form of medical help will not have to worry about spending all their income on getting better. The second country to look at is Germany. In order to access free healthcare, one is required to purchase health insurance. If you are working in a company, you would pay half the insurance or your company would pay the other half. There are two types of insurance, one being the public and the other being the private insurance. Both have their pros and cons, and going over them would take a lot of the time to explain. However, the gist of this is one would simply walk into a clinic and hand their health card and would not be billed, or in some cases would be billed and they would transfer the receipt to the insurance company. There are over 130 health insurance companies in the country to help choose from, and that in itself has its own pros and cons. As a result of having to buy insurance, appointment times with doctors would be much faster, and any citizen could seek almost any type of care that is needed. So getting to the subject of this video, what would happen if the whole continent of Africa had universal healthcare? Well, for this to happen, the people of Africa would have to pay taxes, and the task of continuously collecting taxes from people in the dense cities to the remote villages would be daunting. A majority of the GDP of all African countries would also have to be altered to take care of everyone's medical needs. It may be a good thing because it could reduce the amount of corruption within the government systems. As a result, some African countries with high populations like Nigeria or countries with a weak economy like Somalia would struggle with free healthcare. Some people of Africa who are typically healthy would not like the idea of paying for other sick people, and some irresponsible people would not have an incentive to stay healthy because they can always make use of the system. An alternative to paying tax could be community-based healthcare systems that would take care of smaller groups of people in pocket communities. Or maybe instead of taxation, a fixed amount calculated in parallel to each person's living expenses could be collected to fund the healthcare system. But as far as the good it would do, we can expect an extended life expectancy and an increased psychological comfort, as one would not have to wonder where they would acquire money to take care of themselves or their loved ones. Speaking of loved ones, there would be a drastic alteration to the infant mortality rate, giving more babies a chance to live than before. Mothers would not have to worry about maternal deaths during live births, as qualified doctors and adequate medical equipment would be available when welcoming their newborns into the world. Remember that we said universal healthcare in Africa. This would mean that anyone traveling throughout the continent would not have to worry if they got into an accident or needed some form of medical attention, because it would be at no cost and the charges would probably be forwarded to their country of origin. If done well, a universal healthcare system funded robustly would improve the equipment and resources in major hospitals. There have been stories of people dying because doctors did not have the basic equipment needed to treat the patients. Moreover, Africa is currently seeking a way to improve this concept, so let's see what happens in the coming years. Now we turn the question to you. Do you think having free healthcare would change Africa for the better? Do you think we should pay taxes or donate money to a national account to fund everyone? Or is it just a waste of time? Indulge us with comments below. Would love to hear your story on this. If you'd like to be informed when we roll out new videos, give us a like to help us with the YouTube algorithm, share this with a friend, and drop a comment if you disagree or would like to request a video. Till then, brothers and sisters, have an awesome day.